Hello everyone, it's me, Tiffany. Welcome to my channel where I share all things pregnancy, postpartum, and motherhood related. I am a certified birth, postpartum, and bereavement doula. So that means that I support women and their families on their journey from conception to postpartum. If you have not had a chance yet, please check out my website at www.sacredarrival.com, where you can check out my doula services, you can check out my childbirth education courses, and you can also check out my merch. So the other day I was doing some childbirth education and I had a client ask what an ectopic pregnancy was, okay, and what the difference between an ectopic pregnancy and a miscarriage was. So it made me think, and I was like, well, let me get on here and share some information that other people could use so they will be aware of what the key differences were as well. So I wanted to say that while no one wants to think about pregnancy and like complications that could arise in the pregnancy ending early, it is a reality that some of them do. Sometimes it's just out of our control. So it's important to know what to look for so you'll know. And if you feel like something is wrong, you'll know, what to do and where to turn, or, what help that you may need. It's also important to note that just because you have a miscarriage or an ectopic pregnancy, that it does not mean that you would not be able to go on to have a normal or successful pregnancy, okay? I had 2 miscarriages back to back, one at 6 weeks and one at 15 weeks, and I was able to go on and have 2 successful pregnancies afterward, okay? So what is an ectopic pregnancy? This happens when the egg is fertilized and it attaches outside of the uterus, which means it cannot grow normally or properly, okay? It typically will grow like in the fallopian tube, and this will cause some pain, and it can also be very, very dangerous, okay? So some things to look for: if you've missed your period and you know that you are pregnant and you're like 6 to 8 weeks out, if you're having any kind of abdominal pain, lower abdominal pain that may start out on one side and it can spread like out your abdominal area, if you're having some light or heavy bleeding, just any kind of pain that you're having, if you're feeling faint, things of that nature, you want to reach out to your provider, okay? Especially, again, like I said, if you know that you do or you have had a positive pregnancy test, you're definitely gonna want to reach out. So growing up, I had a childhood friend. We're gonna do a story time real quick. We had a childhood friend, and she ended up finding out that she was pregnant, and she did not want to tell anyone. She was afraid. Come to find out, it was an ectopic pregnancy, and her fallopian tube ruptured and she bled to death, okay? And I can understand, being a teenager, you being afraid to reach out and tell someone something that's going on, but I really do hope and pray that anyone that is watching this, if you have something like this going on, that you do not hesitate, okay? A lot of the times you don't need to do anything with the ectopic pregnancy because the egg will absorb itself, but sometimes you do need to have either surgery or you give medication to help the egg absorb, okay? Now with the miscarriage, it's way more common than an ectopic pregnancy is, okay? A miscarriage takes place generally within the first 12 weeks of pregnancy, and it's considered a normal, I guess, creation or start, because it is inside of the uterus, right? So a miscarriage can happen when you absolutely do nothing. You can do nothing to cause a miscarriage, or you can have, environmental factors. You can have like physical things that go on, like physical injuries and things like that, that can cause you to have a miscarriage, okay? If you do know that you are pregnant and you're having like abdominal cramping, you're having fever, you're having chills, you are having some bleeding, you do pass blood clots, it's important that you go into your provider and you do follow up to see what is going on. They can do an ultrasound to find out. They can also do lab work to see like what your levels are and things like that, to determine whether it is a viable pregnancy and the levels are rising or if they're falling and things, okay? Similarly with an ectopic pregnancy, with a miscarriage, sometimes you do not have to do anything and it'll just pass on its own. Sometimes you do end up needing to have surgery to have the pregnancy removed, or you can also take medications to help the pregnancy pass as well, okay? So just wanted to get on here. I'm actually at the hospital. I had a client that came in this morning at 4 to be induced, and my little lady, she's in there not even dilated right now, and it's going on. Well, it's 10 o'clock now. So I had to take a little break to come out to go and grab me something to eat. But I just want to get on here and just kind of, share the information with you so you know the key differences between an ectopic pregnancy and a miscarriage, and the things that you need to look out for. So that way you will be safe and you'll be prepared and the options that you do have. But as always, I thank you so much for watching, and I will catch you on the next one. As always, comment, like, share, and subscribe, and thank you.